It's exactly time for us to bring you radio according to Dr. Luanda BMDTSHWA, and he is actually going to be letting us know namhlanje about the effects of BUBBLY. Abanye ke bathi ke water pipe over again, abantu abadala besithi ke is a host pipe, and more than anything, I think the name that is actually being used nowadays by ulutsha kuthiwa ke ishisha. But actually, quickly before we talk to Dr. BMDTSHWA, we actually did a bit of history looking at i-hookah pipe uba ngaba ke isukela phi, ngoba siyazi uba ngaba abantu abaninzi ke abantu baye bayithanda ke baze bayithethelele, especially if you look at the Middle East back in the day, kuthiwa ke in the Arab world and the Middle East, people smoke water pipes as part of their culture as well as traditions zabo. But also, if you look at South Africa, in South Africa, sayazi ke kuthiwa ke la shisha lela gama ke bendithethe ngalo, kuthiwa ke however, we're looking at an increasing popularity with South Africans, especially ulutsha. Without wasting any further time, siyabulisa kunjani doc?
Good afternoon, Lady P, as well as the listeners. Otherwise, I'm good.
Good. Let's get straight into it. Yes, let's kind of get straight into it. Bangabage, what are the effects of this BUBBLY? Yenza ntoni emzimbeni, especially for me.
All right, thank you. I just want to start with a little background on the BUBBLY itself, which is a water pipe. It is a smoking habit, or the technique itself is smoking. So by smoking, it should be containing tobacco. And within the tobacco, we're looking at the nicotine, which is the active ingredient, like all the other cigarettes or smokable items. Nicotine is the actual active ingredient. But because it comes from the tobacco also releases other chemicals that are also not so good for the body. So you might have a statement saying, I'm smoking a nicotine-free water pipe. It's free of nicotine, but it still contains other ingredients that are released by the chemical itself, which are also harmful to the body. So you have that setting. And with the water pipe BUBBLY, we have two processes going on. It's the burning of the tobacco itself, as well as the coal, which is additional to the normal cigarettes. So the harm comes from the tobacco, which will contain nicotine. If it does not contain nicotine, it will still contain other elements of the tobacco itself. Because the tobacco is from the ground, it will be absorbing all the elements from the soil, your lead, and when it's burned, it releases some gases which contain some harmful substances besides the nicotine itself. And then when you get the coal itself, which is not available on the cigarette. So when you smoke the water pipe, you are getting the tobacco. In addition to the tobacco, there's also the charcoal that you are also inhaling with all its chemicals. What are the effects generally here is that you've got the nicotine that works like any other nicotine, and you've got the coal that releases the carbon monoxide. This carbon monoxide sort of competes with oxygen in your lungs. You've got carbon monoxide released by the tobacco burning itself alone, and also coming from the charcoal. So you've got an exaggerated amount of carbon monoxide in the body that competes with the oxygen and displaces it. So this will affect the way you breathe, as well as the way you circulate your oxygen on the body. But more than that, why people do smoke the water pipe? Yes, I think in this time and age, we had pipes, which is in now, which they smoke polile, and we also had the cigarette. The tricky part about the cigarette in now and the water pipe is that with a cigarette, it's one cigarette that you'll burn and finish it within 10 minutes, and you are done. Until you have a craving, you open another one. And chances are with the cigarette, you will smoke it alone and not share with anyone. There are settings where in the rural areas and stuff where people start sharing the cigarette. And then with a pipe in our alone, you try the whole week. Try the following day, one of those things. Now coming to the water pipe, it comes in a setting where the length of the water pipe itself is about 45 minutes. When you light it, it runs for almost at least 45 minutes to an hour. It will depend if is it being pulled, imizilahle liyatsha okanye ihleli ibethwa ngumoya kumbe isebenzisayo. And then it will have different pipes on it. It can have 1 or 2 or even 4 now. So depending on how many people are using it. Again, this brings the issue of hygiene in it, where you've got
Yes.
many people pulling on the same mouthpiece. Yes, yes. And then the other myth about the water pipe is that because you are pulling it through the water, so you're burning the tobacco. And again, the tobacco with the water pipe is a bit oily. So the oiliness on it, it allows to stay longer than when it's dry like a cigarette. Where you burn it, it burns now. With the oil, it sort of takes longer to burn, which keeps it for that duration of 45 minutes. So you're burning this tobacco, which is oily, which will take longer to burn, and you're also pulling it with the smoke from the charcoal. And you pull it into the water. The water mostly it just cools it down so that you can inhale it without burning your lungs and stuff. But the chemicals that comes from the tobacco as well as the charcoal, it's about 3% that is being reduced. So most of the contents they are still inhaled. It is very fancy. It's acceptable. That's another issue. If you open a cigarette in front of the parents, or even at a workplace, or even in the club, you are told not to smoke it. With the walker pipe, it's something that even on the closed room, in front of the table, even at family setup, it's something that people do smoke. It doesn't raise any issue of misbehaving and all that. That is another issue. Coming now to the actual effects of the hubly, which is
Yes.
the tobacco, or even if it's not the tobacco, but the actual contents of the tobacco and the coal. Like I said, one is the hygiene, where you have this mouthpiece that you are sharing. You can have TB, you can have herpes, which is one of the mouth ulcer infections. You can also have hepatitis C, which is a deadly virus that if someone smokes with an open or cut in the mouth, they can also leave it there and somebody else can make contact with it. And then you've got the immediate effects from the element of tobacco itself, where somebody starts to feeling a bit high or relaxed, or they might even cough immediately, especially with the new smokers. And then it also raises your heartbeat, your pulse rate. You might somehow feel a bit suffocating or difficult to breathe. And some can have hypersalivation. That means there's too much saliva in the mouth. And with others, it can even cause some discomfort within the stomach or the intestines to move a bit crunchy. And then the longer term effects, you're looking here at the smell on the mouth. As much as the flavor is there, but the tobacco, it remains part of the ingredients. So it will have such a smell. You will have issues with the gums and the teeth, that they might be infected or they might lose that thickness of the bone. In the lungs themselves, some people might have some existing conditions. You've got asthma and you smoke heavily,
Yes.
which is tobacco. So it might
Yeah,
make
that's my
things
question.
worse.
That was
And
next.
and then some people have allergies that they're not even aware. And most of the time when you smoke heavily, you don't smoke it in isolation. Most of it, it's in the places where there's some social event happening. There will be some alcohol, some illicit drugs you are eating. So one of those interactions between the tobacco itself exacerbating the allergy and might have wheezes, that means closing of the airway, difficulty to breathe. And in the long run, it might cause what we call it chronic obstructive airway disease, where even with simple medication, it is impossible to reverse the airway so that the lungs can open and close while you breathe in and out to allow air to come in. And some of the elements that are found within the herbally, they can cause cardiac problems. That means they can make the blood to become very thick and clots, and also the walls within the blood vessels, they can become very hard. Remember, with each heartbeat from the heart is supposed to pump your blood from the heart into the rest of the body. So with that movement, the blood vessels need to be elastic. They need to dilate and compress in response to the heart and also propelling the blood to the rest of the body. So that can also cause problems within the heart itself, coronary heart diseases. With the thickening of the blood, you might have strokes where the clot can dislodge and go up into the brain and cause strokes, as well as the legs where it blocks the legs and people can have DVTs. And then you also have the effect of cancer, not
Yes, which is
necessarily from the nicotine, yes, but the elements that comes with the other elements released by the tobacco, they tend to cause cancer in various organs. The lung is very common. We have seen as well with the stomach. We have seen cancer with the bladder.
yes.
Also, we get effects from pregnancy. Most people who smoke this hardly will, even a cigarette, like I said, it contains the same tobacco. There isn't much difference between the hardly and the tobacco. Again, to note, with that duration of 45 minutes and the cigarette, when you smoke a hardly, your risk of inhaling all these chemicals ranges from about 100 times to 2,000 to 200 within that period of 45 minutes. And it is continuous. So with reproductive system, where I've said pregnant women, they have chances of having early birth, which is pre-term delivery, and the babies that they are carrying when they deliver, you find that they've got a very low birth weight compared to the counter babies. They could be less than 150 grams, 1,500 grams, very small. And also, we have seen some issues with I think cancer I've mentioned, yes,
Yes, we
cardiovascular,
have mentioned.
reproductive, as well as cancer of the esophagus, which is the sore throat. It's very common as well. Basically, those are the major concerns that we can see with this use of the water pipe.
The reason also, Doc, we even wanted to have this conversation with you, especially Siluluta, also looking at the history of Bangabake, iyathandwa as South Africans, Okanyani, and you even find Bangabake, we are figure at Groove, Ulucha, notsalana nezi-pipes, and you even see umntu xa efuna bangathi uphelelwa nangumphefumlo. So for me, it's always been a question of Bangabake, if you really suffer from into ezidibanisa nesifuba, why do you do it? Like, you will hear people saying, na enjoyment, you want to relax, and you find abanye they even put in, yes, itobek ukhona, abanye bade bafake ke nentsango, so that they say that they're relaxing themselves, but they do not know bangabake in the long run kuzakwenzeka ntoni, that's actually killing you. And I've been also just posting, showing pictures of bangabake nyani ke ioka. It is definitely deadly. Oh, now to bangabake just because I'm doing a water pipe in a man, so it's healthy. So I think we've got ezo misconceptions, of which I'm really happy when I talk that you're able to highlight them. I've got a colleague of mine ude athi ke comment bangaba ke yo ingayekwa nje xa kunjalo. Mayivele nje imeko ngoba nyani iyabulala. And I'm also looking at ixesha lethu wena Doc. Let's quickly look at ways to stop actually smoking happily.
I think one is to make awareness of what is written on it. It's not exactly what is on the contents, because it will say it doesn't contain any tobacco. And more than anything else, like I said, it's not really the tobacco itself that is an issue here. It is the charcoal, it is the other elements that comes with the tobacco. It's not the nicotine. Yes. So we do have centers that will assist with stopping of smoking. We've got the National Council of Tobacco, which is available. We've got cancer, but that is at the late stage where people have already contracted. People should go to their nearest clinic, see their GPs if they realize they've got issues with stopping the pipe. Because you also have some smokeless, terms of smoking where there is no smoke. That means it takes away the effect of the charcoal itself. You might have tobacco in a different way, in a patch, in a chewing gum. This is just a start to move away from the smoking. And then once you get that, you can replace the actual effects from those elements with something else that is less toxic than the other one. But anyone who has a problem with smoking, they should consult their nearest doctor. It is just that it is part of the social component that we might need to make more education on it than waiting
Definitely.
for them to come to the doctors and stuff. So people who are using it or selling it, it's part of business as well on the other side. We can't really say they must close it down, but it is up to us as the youth to realize what are the dangers that it brings to us.
Definitely. Just one more question, Doc. We
Is
have
it addictive?
also a colleague here to is it addictive?
The addictive component of it is, yes, in a sense of being in a social space, it is addictive, even if it doesn't have the effects, in a sense that it socializes people. Once you put a water pipe, people come around and then they gather. That is just a non-medical part. But on the pharmacological part, if it contains nicotine, yes, it is addictive. Nicotine, it is addictive, which is part of the tobacco, like in the cigarette.
Oh, okay, perfect. I think colleague yami ivile uba ngaba ke nyani ke kuthwani na. Thank you so much, Doc, for your time. Siyabulela kakhulu for actually highlighting ezi effects zezekayo emizimbeni. Xa kutsalwa ke laa nto kuthiwa yishisha ke xa beteketisa, which is known as i-oka okanye i-bubbly. Thank you so much, Doc, and I hope we will have more conversations actually with regarding nyani ke ezi zinto zithandwa lulutsha zingalunganga kakhulu. Thank you so much and have a great day further.
Thank you for having me, Lady P, and thank you to the viewers and the listeners to be part of the show. Thank you.
Thank you, sir. All right, kubaphulaphuli bonke abakhoyo ke ngaleli xesha, we were in conversation with the Dr. MDITSHWA sisiva uba ngaba ke ithini nale nto yale hookah pipe, i-bubbly okanye ishisha, and as well as what does it actually do within the body in terms of we've heard, in fact, ezinye izinto nam ke ndizothukile, yes, I've heard uba ngaba ke nyani ke into ze-cancers bakhona, and also at the same time you all share the same pipe at times. You know, I see these things happening, and I'm always asking myself, sanitizer, no sanitizer, itusuka komnye umlomo, iphinde ize komnye umlomo. So do you actually think about what it's actually going to be doing to you in terms of your hygiene? But yeah, I guess abanye abantu now they definitely know. So also just to show you just a couple of pictures also, hookah smoking is deadly, do not be fooled, definitely. And also a picture that actually I took from Twitter the other day. Well, a conversation actually about what are you convinced that people are just pretending to enjoy? Happily, people just do not enjoy it. And also, lastly, just before we close it, did you know smoking a bubbly is not a safe alternative to cigarette smoking? As we had mentioned, again, a doc pipe, but at the same time, we are slowly but surely. And yes, yes, I'm happy. Silapha ke sithandwa thina uzasifona ku-Facebook okanye ku-YouTube kwelaa cala sikafikeleli, but that does not mean uba ngaba ke asizofikelela. So please make sure that you do follow us, and also our website here with www.keithlessradio.com, and simply also download the KNR app or Google Play Store wethu uzokwazi ukusifumana. Thank you so much to everyone who joined the conversation namhlanje. Buzizokona imindimole early on, usiphe unini, siyakubona ndabulela nakwabanye ke bakhoyo. From me to you, it has been amazing, it has been lovely, but also to catch us again tomorrow. DJ Caesar is coming through, is out again, the KNR Drive between the hours of 3 and 6 o'clock.